Hello friends. I'm your health and wellness coach, Dr. Harkirat Wilkhu. Today we will talk about most vulnerable health issues worldwide. Diabetes, especially the type 2, which is among the top 3 of 80% of the chronic diseases, and is also known as sweet disguise. Diabetes is a metabolic disorder, presented by group of signs and symptoms that lead to various complications if left untreated. Diabetes affects the vital organs including heart, brain, kidneys. Diabetes management is broadly divided into two major areas of management: conservative management and lifestyle management. As diabetes is a chronic ailment, we need to understand our goals and limitations. Diabetes management mainly focuses on goal of maintaining target blood glucose. So, let's see the golden rules of diabetic management, we call it. Rules of hexagon. Have a checkup on regular basis. Eat diabetic diet with calorie control and proper nutrition. Do exercise to burn out the calories consumed and tone up the body to reduce insulin resistance. Manage your stress with active and passive stress management methods. It's very important to avoid any dependencies, like tobacco. Take care of your skin, especially the foot. Let's know the risk factors. Non-modifiable, like family history, age, gender, and race. These cannot be changed. Medical risk factors. Comorbid chronic conditions, like BP, cholesterol. The list is quite long. Lifestyle related. As we understand, diabetes is not easy to get rid of. It's best to beat it with lifestyle management. We can do it with strict diabetic management protocols. Be physically active by doing some form of exercise. Eating a diet low in glycemic index, which is sweet index of the food. Monitoring closely your glycated hemoglobin, which gives 3 months glucose analysis. Blood pressure, lipids, and also tobacco use. And very important, tracking the change of blood glucose levels. Diabetic metabolic syndrome is a complex group of signs and symptoms, which may be classical or rare. These rare signs and symptoms are neglected most of the time. You should be aware of these. Frequent urination, in compared to your fluid intake. Increased thirst, increased hunger, or frequently feeling hungry. Occasional blurred vision, frequent urinary infections. Itching on skin without any eruption. Tingling or crawling sensation on hands and feet. And also weight loss without any known cause. Dietary management is the first most important tool for diabetes management, which focus on 3 basic aspects of diet, like diet and calories, rules of nutrition, and nature's pharmacy. Diet and its calories. We should always consider these, like preferring complex carbs than simple ones. Eat more of complex carbs from whole grain, vegetables, etc. Choosing wisely between starchy food and non-starchy food is very important. Inclusion of superfoods, lilke, almonds, sesame seeds, fish, eggs, beans, broccoli, berries and mushroom is very good. When we are talking on diabetes management, rules of nutrition plays important role. Glycemic index and glycemic load. General understanding. Glycemic index indicates how fast glucose spike can be produced by the food. It's good during hypoglycemia, dehydration, fatigue, and also during intensive exercise. Prefer fresh fruit juice for high in GI. Glycemic load refers to amount of glucose and calorie a carb can give. Food high in GL gives lasting carbs which give rise to glucose slowly. Beneficial for maintaining blood glucose levels for longer time. Preferred complex carbs. In and out. The calorie we consume should be burnt. Fat versus fiber. Avoid too much of fatty food and compensate it with high fiber intake. Supplements like vitamin E help cell repair and prevent cell degeneration. Soybean, sesame seeds are good source. Vitamin B12 help RBC and prevent anemia. Organ meats, red meat, fish, and fortified cereals are good source. Vitamin B6 helps RBC formation, improves nervous function. Regulates serotonin and dopamine. Chicken, fish, peanuts, soya bean are good source. Vitamin C helps cell growth and repair. Good sources oranges, strawberry, broccoli, Brussels sprouts and peppers. Minerals like magnesium helps in metabolism, neurotransmission, mood regulation and anti-inflammatory. Good sources: pumpkin seeds, almonds, peanuts, black beans, avocado, kidney beans, yogurt. Chromium promotes insulin sensitivity. Good sources: lean meat, poultry, eggs, seafood, lentils, nuts and seeds. Enzymes like glucokinase, carnitine, biotin help to regulate insulin production. Simple plan to follow is hypoglycemic diet. Eat complex carbs like whole wheat, brown rice, multigrain. Eat 1 serving of vegetables at every meal. Preferred raw and uncooked. Eat 1 to 2 whole fruits. Low in glycemic index daily. Increase intake of nuts and seeds. To get more of magnesium, chromium, and omega-3, reduce daily consumption of saturated fat and oil, like butter, clarified butter, ghee, margarine, palm oil. Better prefer oils rich in polyunsaturated fatty acids, like canola oil, corn oil, soybean oil, generic vegetable oil, sesame oil, peanut oil. Reduce daily consumption of common salt, limited below 1 gram or 1 teaspoon per day. Avoid carbonated fizzy drinks, as it causes calcium loss, and reduce absorption of nutrients. Avoid caffeine intake, like black coffee, purple green tea, herbal tea. Exercise is second powerful tool for diabetes management. Exercise has various components of activity, like warm-up, stamina, strength, and flexibility. For diabetes management and better health, we need to do exercises on regular basis, following the rules of exercise. Before engaging into any exercise, take a proper consultation by a physician for evaluating the health status. Secondly, according to health status and comorbidities, best exercise components are selected. Once the exercise format is decided, exercise regime has to be designed, considering duration and time of exercise. When doing exercises as diabetes, we need to focus on cardio exercise to boost the metabolism, like brisk walking, jog and walk, swimming, cycling or cross-trainer. It's very important to keep the focus on the heart rate. The optimum heart rate during the exercise is between 150 to 130 beats per minute. Cardio exercise is followed by strengthening exercise, like exercising with dumbbells, doing squats, steppers, modified sit-ups and push-ups. After doing stamina and strength exercise, it's important to do breathing exercise to absorb more oxygen, like Bhastrika, bellow breathing, Kapalbhati, forced belly breathing, as yogic breathing, whereas, in Western method of breathing exercises, diaphragmatic breathing, the breathing exercises should be done for minimum of 5 minutes. When we do exercise, there is quantum effect with sequence of benefits. On doing exercise, the muscles are relaxed, releasing endorphins, the good hormone, which helps to repair, rejuvenate and reduces physical stress. It also induces sound sleep, leading to mental relaxation. Once physical and mental relaxation is induced, it increases the insulin sensitivity, causing reduction of insulin resistance. When exercise is continued for long time, it helps to improve or maintain the weight and metabolism. Stress is known to be maintaining and triggering factor for many chronic morbidities. Stress can be managed by various methods, like exercise, which is an active form that releases good hormones, the endorphins. Yoga, a passive form, which induces deep mental and physical relaxation. Breathing techniques. Broadly, breathing techniques are both active and passive forms. Breathing techniques relaxes the physical and mental sphere. Then comes the sleep hygiene. The exercise helps to improve sound sleep, which is very important to reduce the overall stress. Health behaviors play an important role in diabetes management. Tobacco is considered as second most vulnerable risk factor for chronic disease. Whether tobacco is used as oral or as smoking, it's very harmful. Tobacco has over 4,000 listed chemicals. For diabetes management, we need to understand the effects of harmful elements. Carbon monoxide, which destroys oxygen. Acids, which destroys endocrine or secretive tissue. Alcohol, cauterizers. Brain. The overall impact of tobacco. It increases bad cholesterol LDL. It reduces good cholesterol HDL. Increases insulin resistance. Overall, increases risk of developing type 2 diabetes or complicating it. Let's recap the learning. Have regular checkup. If you have a family history of diabetes or any other pre-existing conditions, monitor your glucose levels. daily, weekly, or fortnightly, as required and advised. Take your prescribed medicine regularly. Avoid extra and simple sugar. Avoid caffeine and tobacco. Avoid frequent consumption of commercial food, especially fatty. Do regular exercises, especially cardio and strength. Manage your stress. Thank you for watching. If you have any queries, please feel free to communicate. We will be happy to support you.